Okay, so the majority of prostatic enlargement is related to age, in fact. So as a man gets older, the prostate gland increases in size. There's nothing specific in terms of eating and drinking or things that you do that really make a difference with regards to this. Sometimes it can be genetic. So if your father had a big prostate, you might have a big prostate. But generally, as we get older, all our prostate glands will increase in size. Having said that, not everybody who's got a big prostate will have lots of symptoms. Some men may have huge prostate glands and have absolutely no symptoms at all. Other men may have small prostate glands and have quite a lot of symptoms. Generally, the symptoms being slow flow, intermittency, hesitancy, i.e. taking a few seconds before they can get going. Sometimes when they feel they finished, a little bit more comes out, alternating dribbling. Waking up at night time, which can, of course, be multifactorial and not just related to the prostate. Other symptoms include frequency of passing urine, urgency of passing urine, but the more important ones is if you do ever have blood in your urine, then you must report this, because this is one of the more dangerous signs of prostate disease or bladder cancer or kidney cancer. Diet and exercise do not make a great deal of difference, in fact, specifically to prostate health. Generally, we know that if you have a good diet, good healthy lifestyle, taking your steps, taking your fluids is better for your general health. And that's why that's more important. I mean, if you're taking your 10,000 steps a day, not eating too much of the fatty foods, carbohydrates, keeping your weight low, you are generally better. When you're generally better, you have less issues such as heart disease, which can cause you needing to pass urine more often at night, particularly, which is often one of the most bothersome symptoms of prostate disorders. Or if you overweight, you can have sleep apnea, which can sort of result in you sort of having to go more often at night time as well. So general diet and well-being, it's important to be as fit as possible, to have an arbitrary number, a nice BMI that's within normal range, and all of those factors will make a difference. So, if you are drinking lots of tea and coffee and you're needing to pass urine more often, that's not necessarily related to your prostate, but it will make a difference to your sort of waterwork symptoms, which is essentially what we're talking about here. So prostate cancer is a complex condition. It's something that can be diagnosed very early on to something that's diagnosed with evidence of spread all over the body. So when we talk about prostate cancer treatment, it's not a one treatment or two treatments fits every single patient. Now, the most important thing with prostate cancer is knowing whether you've got the prostate cancer or not. And you as an individual, what you could do is to get a PSA done. So if you've got a very strong family history, as in your father, your brother, your uncle were diagnosed, in their early 50s or even younger, it's probably worthwhile you getting a PSA blood test done. Now, PSA isn't a specific prostate cancer blood test, but it's a marker that can be a trigger for further investigations. We don't quite yet have the PSCA, which would be prostate-specific cancer antigen. But what we do have is the PSA. So if you have a PSA done, the PSA is above your normal age range, then you'll be referred to the hospital, most likely have an MRI scan. If it looks suspicious, then you'll have biopsies done and then further investigations. Now, depending on what that shows, you might have, we'll just go through the various stages. You might have something called low risk prostate cancer. And one of the options for that is just to monitor the disease, see, is it progressing? So you would have regular PSAs done, regular MRI scans done, potential biopsies done. And the reason we do this close monitoring is to prevent you needing any treatment at all, because if you don't have treatment, you don't have side effects. And by what we're aiming to do with this is to pick those patients up who have what we call the tiger prostate cancer, which may harm you, rather than the pussycat prostate cancer, which is just going to be present, and then treat only those patients. You might have slightly more aggressive prostate cancer, which requires options such as removal of the prostate gland. Now, the majority of patients nowadays, if they do end up needing removal of the prostate, will probably have it robotically performed, often as an overnight stay, very quick recoveries. You may have a catheter in place for a bit. And of course, it is an operation. You will need some time to recover from it. The longer term side effects of this is usually either erectile dysfunction or incontinence, but these rates are reducing as people are getting more experience in doing this. An alternative to this would be radiotherapy, and there's various types of radiotherapy available. Essentially, this is using X-rays, focusing it on the prostate gland and killing all the prostate cells to try and cure you of the cancer. Often with this, you will have hormone therapy attached. So essentially, prostate cancer feeds off testosterone. So if you stop the testosterone by stopping the hormones, then the prostate cancer shrinks. And we know from big studies that for radiotherapy patients, that if you prepare all the cells, they respond better to radiotherapy. Hormone therapies are often a mainstay of treatment if you've got evidence of spread of the prostate cancer outside of the prostate. So you'll often start off with a drug such as Casodex, which you'll take for 21 days, which switches off your testosterone. And then you'll switch to an injection, which may be monthly, 3 monthly, or 6 monthly. And then beyond that, there are newer drugs coming onto the market, which are often managed by the oncologist. So if you do have prostate cancer, you'll first often come to the urologist, either in the NHS or in the private sector, and then you'll be managed in the multidisciplinary team. So you'll see the urologist, you'll see the oncologist, and then if you have complications, then you'll see various other specialists to try and help with those symptoms. So it's a wide range of things, and what we always recommend is speak to your doctor about what options are available for you, because we'll always discuss these cases in a multidisciplinary team and try and focus the treatments to what you need and what would be the best for you. I mean, there's not a great deal of evidence for lots of vitamins and tablets that help with the prostate gland. Some large studies have been done. Possibly cooked tomatoes and the lycopenes in there might make a difference. Zinc may have a little bit of evidence, but essentially there isn't a great deal. Now, possibly drugs like saw palmetto or pumpkin seed extract might help shrink the prostate gland. There's certainly a lot of supplements that are available on this. But essentially, these are things that you can try at home, but don't rely on those. The most important thing is if you do think you've got something going on, go and see your doctor if these over-the-counter remedies don't make a difference. Essentially, eat and drink healthy, lead a healthy lifestyle, and that will help with your waterwork type symptoms. So, but don't go and spend lots of money on lots of supplements until you know exactly what's going on with you. So prostate problems, both benign prostate problems or malignant prostate problems, are related to age. So as you get older, you're more likely to develop waterwork problems or prostate cancer. So most men in their 20s will be peeing very well, will rarely go at night, can go out to the town, drink plenty, and then not sleep through the night. But as you get older, if you get in your 40s, your 50s, your 60s, you're more likely to be getting up a bit more. You're more likely to be having a slightly slower flow. And for some men, it doesn't really matter. They'll go for a pee, they'll go straight back to bed, no problems. Other men will be troubled by the symptoms. And it's those men that need to come and seek advice, because we have got options available, from medications, lifestyle changes, to surgeries, which you can go in and out, have done under local anesthetic, something like the urolift for the prostate, or something a bit more invasive, such as a Holette procedure or a TURP. All the various options that are available will be discussed with your surgeon.